Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, your OET mentor, and welcome to the best institute, Dr. BKM Institutes. Our contact number is 76967 34256 if you are looking out for the best OET coaching. And please watch all our videos till end and subscribe this channel right now for the best OET videos. So today we are going to revise a very important thing. What we have done is the writing for this week. But before I revise, I would like to tell you, because some students have exam tomorrow, so I would like to tell few things about the writing. So writing, when it comes to OET writing, first of all, you always read the letter from the end. That means you want to know that to whom you are writing the letter. Because once you know that you are writing the letter to cardiologist, once you know that you are writing the letter to the cardiologist, you will include more of ECG things, more of heart rate, more of pulse rate, more of heart rhythms. So you will be talking about these things. If you are writing to physiotherapist, then obviously you would be talking about ambulation. So most important thing in OET letter is to whom you are writing the letter. That is the first thing. And then the second thing is why you are writing the letter. That is the purpose. So today I want to discuss about the discharge back or referred back letter, because in this week we have already discussed normal discharge plan letter. Yesterday we discussed about this visit letter pattern, which I will put at the end of this video for the people who haven't seen this video. I will put this thumbnail in the end. So if you will click, it will take you over this letter and will tell you the easiest way of attempting OET visit letter. But today we are talking about discharge back letter. So in OET letter, first thing you notice is to whom you are writing the letter. Second thing you notice is why are you writing the letter. If these two things are clear, then it is 90% that you will pass. 90% you will pass. So now let me take you in detail. What is the meaning of discharge back or referred back letter? So I'm just gonna go through this slide. Okay. So I'm taking this new page. Yeah. So discharge back letter. First, I would like to write about this thing. Discharge back letter, that patient is coming from a place. Place means nursing home. Suppose the patient lives in nursing home. Then from nursing home, the patient, the patient comes to our hospital. He gets admitted. Hospital admitted. Then we provide the treatment. The patient becomes better. So the patient condition is better after treatment. So it is very obvious, if the patient has come from a nursing home, he was admitted in the hospital, provided the treatment, now he is better. So obviously he will go back to his nursing home because he lives there. So when the patient is coming from a nursing home, going back to a nursing home, it means it is a discharge back letter. Discharge back means coming from nursing home, getting discharged back to his nursing home. It can be a retirement home as well, not necessarily nursing home. If the person is aged, then he might be living in the retirement home. So these two words you have to see very specifically if it comes in OET exam. By chance, there can be a trick that you will not be able to recognize whether it is a discharge back letter, because they will say write a letter to Elizabeth retirement home or nursing home. They will say write a letter to Elizabeth retirement home, but it would not be given that it is a discharge back letter. But when the physical address of the patient would be given in the front page, so it would be in the back page, write a letter to Elizabeth retirement home, write a letter to manager of the Elizabeth retirement home. In the front page, physical address would be given Elizabeth retirement home. So that means patient lives at Elizabeth retirement home. and you are writing to Elizabeth Retirement Home. So if these two words are matching, then also it is a discharge back letter. Then it is obvious it is a discharge back letter because the patient's address is matching with the place where I am writing the letter to. So please stop this video and re-listen to the last line, that if you are writing to Elizabeth Retirement Home, patient address is also Elizabeth Retirement Home, then it is obvious it is a discharge back letter. So this is the trick of these letters. So these are known as discharge back letter. Now I will tell you a situation. Patient was living in a retirement home or a nursing home. He fell down and he was suspected with the fracture. So the patient was sent to hospital for X-ray. You are the nurse in the hospital. So patient was sent to hospital for X-ray. We conducted the X-ray, and after the X-ray, we got to know the fracture was there. So fracture was confirmed in the hospital. So what we will do if fracture is confirmed, if the fracture is confirmed, we will keep the patient for 1 or 2 days. So the patient gets admitted in the hospital once the fracture is confirmed. After 2 days or 3 days, when patient starts feeling better after the plaster cast, so the patient is sent back. Please keep the focus high. It's just going to take 2 months. So plaster cast has been applied and now the patient is getting discharged back to the nursing home. So in the nursing home, we are telling the nursing home people, then there would be a discharge plan. So in the nursing home, what people need to do, what nurses need to do at the nursing home, they need to provide the follow-up care and take care of the dressing, plaster cast, and everything. Now this is the situation. So what is the best way of writing? What is the best way of writing this situation? Let me write it for you. I will make it very simple. Please keep the patience high and just listen to it. You will enjoy this writing. And this is the most repeated letter of OET. So this letter, again, I will make it easy. Yeah. So I will go step by step what I have mentioned. In the same way, I will write in the final exam step by step. This letter is being written regarding your resident, Mr. X. So I've written that we are writing the letter regarding Mr. X. He is your resident. So this is the first punch of this letter, which gives you mark. When you write, this letter is being written regarding your resident, Mr. X, who was admitted to our hospital, or I will go by situation, who was referred to our hospital with suspected fracture. Now I am going to the point that when the patient was admitted to us, he was having suspected fracture. Yeah. So I will the easy you will write, the simple you will write, the more marks you will get. This letter is being written regarding your resident, Mr. X, who was referred to our hospital with suspected fracture. After X-ray, he after X-ray or the fracture was, I would write even more simple, even simpler. Fracture was confirmed with the help of X-ray. Fracture was confirmed. That is a passive voice again by us with the help of X-ray. So the fracture was confirmed. So he was admitted for 2 days. Now, or you can say after plaster cast, better if you want to write better, after application of plaster cast and required treatment, he is better. When the patient is better, so he is being discharged back. It's old story. Make it very, very simple. And I'm just going to revise it with you to help you because this is the most repeated letter. This letter is being written regarding your resident, Mr. X, who was referred to our hospital with suspected fracture. Fracture was confirmed with the help of, yeah, you can say, the only word that is missing is in hospital. Now it will make more sense. In hospital, fracture was confirmed with the help of X-ray. So he was admitted for 2 days. After application of this and required treatment, he is better. So he is being discharged back. So that is why we are discharging back the patient. Why are we writing so over here? We are writing so because he is better. Sorry, not here, here. Why we are writing this connector? So means that he is better. So he is being discharged back. Once he reaches back to the retirement home, when the patient comes back, you are advised to follow few instructions for his speedy recovery. So this is what you write as a discharge back letter. A fabulous way of writing discharge back letter. The whole story, the whole summary comes in the first paragraph. And this is again the most repeated letter. This letter is being written regarding your resident who was referred to our hospital this. Now, after the confirmation of the fracture, treatment was given. He is better, so he's being discharged back. Once he reaches back to the retirement home, you are advised to follow few instructions for his speedy recovery. If in place of retirement home, it is a nursing home, so you will say nursing home. That's it. Rest remains the same. So just give 2 minutes. I would say write it right now. अभी लिख के देख लो. Please write it right now. It will make it very easy for you. Okay. Now I am taking to the second and the most important point. What is the difference between a referred back letter and a discharge back letter? Referred back letter means that GP means doctor, patient's doctor, sent the patient or referred the patient to our hospital. Rest of the conditions remain the same. Referred the patient with suspected fracture. Now the same thing. After treatment, patient is better. So we are discharging the patient. But we are discharging the patient. After discharge, patient needs follow-up care. It's exactly the same. Patient needs follow-up care. So that care will be provided by the GP. So what is the difference between the two? In discharge back letter, patient is going to the same place. In referred back letter, patient is being referred to us by GP and we are referring the patient back to GP. So there is no mentioning of physical address. So that is the difference. The physical address does not matter in this letter. So again, same copy paste, same. No difference. This letter is being written regarding your resident, regarding your patient. Mr. X, who was referred to our hospital, in hospital fracture was confirmed. After application, he is better, so he is being discharged. Don't say back. Now the last line will change. He is being discharged. However, he needs follow-up care and being his GP, you are requested to provide him follow-up care. This is the only difference. Please understand how simple it is. That this letter is being written regarding your patient, Mr. X, who was referred in hospital. This and this happened. After application of required treatment, he is better. So he is being discharged. So the back word disappears. However, he still needs follow-up care. He still needs follow-up care. And being his GP, commas, comma, and being his GP, you are requested to provide him the required care or the follow-up care. That's it. This is the most repeated letter of OET exam. Then pattern remains the same, social history or medical history. Yesterday, somebody was asking, sir, what are those letters where social history and medical history are not required? These are the two letters where social history and medical history are not required. Because the patient's GP already knows about the patient's social history and medical history. In the same way, if patient is living in a nursing home person also knows about social history and medical history. So in these letters, there is no social history and medical history. This is the most important thing. So the second paragraph directly starts from during hospitalization. So that is the only difference. And this paragraph can be of, and in these kind of letters, deliberately means जानबूझ के, intentionally, they will give you lot of social history and medical history to confuse you. Lot of social history and medical history. You just ignore it. You said during hospitalization, the patient was given this and this thing. Simple. You can make two paragraphs of during hospitalization, or you can make two paragraphs of discharge plan. Now, I am putting up the discharge plan letter at the end so that you can see the discharge plan pattern. How to write a discharge plan. Just click on the link and you will be able to see the discharge plan. So this small video, which compiles of discharge plan letter, visit letter pattern, and this discharge back or referred back letter is the whole to OET. 99.9%. These are the only letters to be done. So during hospitalization, if takes one paragraph, so then during discharge plan will take two paragraphs. If during hospitalization, it would be according to data. If it will take two paragraphs, then I will make one paragraph of discharge plan. So I will try to keep it same couple. And this is the most repeated letter. And the three letters we have done is very important for the upcoming exam that is due tomorrow. So please watch all these videos so that you can have a better tomorrow. Tomorrow means tomorrow only. That is tomorrow you are having an exam. So the people who are having an exam, these three letters will definitely help you to get over it. Again, the fundamental of OET writing is very simple. Whatever, please behave as a nurse. Understand the situation. Understand to whom we are writing the letter. Once you know that you are writing the letter to a nursing home, and if the patient also lives in the same nursing home, they know about social history and medical history. So you will, how would you say? You will say this letter is being written regarding your resident, Mr. X, who was referred to us due to this thing. After treatment, he is better. So he is being discharged back. He is coming back to your place. He is being discharged back. Full stop. Once he reaches there, you are advised to follow few instructions for his speedy recovery. So this is the plan. That's it. And if when it comes to GP, we will say he is better, so he's being discharged. However, he still needs follow-up care. And being his GP, you are requested to provide him the required care. That's it. This is Dr. Bhupesh from Dr. BKM Institutes, assuring you these small but nice but good simple videos and the same follow of Following up of this pattern will help you to pass your OET writing exam with complete ease and comfort. Thank you.